Let's get real. Let's get loud. On America Out Loud Talk News, this is McCullough Report and Focal Point Substack. It's a great honor to welcome to the program for the very first time Dr. Todd A. I met Dr. Bourne at an academic meeting, and he gave a terrific lecture on attention deficit hyperactivity disorder, ADHD. So I wanted to bring on the program and really just, highlight what he's learned about this now very common disorder in children and some practical approaches. Dr. Bourne, welcome to the program.
Sure. Thank you, Dr. McCullough, for inviting me. So, yeah, I've been in practice for 16 years, and I see a lot of, patients that get referred to me, adolescents, young children, even adults with ADHD and various, mixed type, and then, of course, the comorbidities that come along with that, anxiety and depression and insomnia, and there's conduct disorder, oppositional defiant disorder, whether DSM-5 classification you want to assign to it. But most children are being brought to me because of usually a handful of things. One, there is some pressure in the school to medicate the child, to get them to be able to focus and pay attention and be less disruptive. And they either want to try alternatives to the medication, since they, I'm not anti-medication, time and place for everything, but they're not certainly without their side effects, and they're just a Band-Aid. They're not a fix. And as an
right, so let's, before that's a good teaser, but before we get into it, why don't you just introduce yourself in terms of your background, your training, and where you live and practice now?
Sure. So this is my 16th year of practice, and I am a naturopathic physician, and I graduated from Bastyr University in 2010, and I completed my residency at the Bastyr Center for Natural Health in Seattle, Washington. It's 13 teaching clinics, and then I was fortunate to actually rotate through the Seattle area hospitals. So I was in 2 emergency departments. I was at the Virginia Mason Department of Phys Med and Rehab. So I got a lot of, the emergency medicine, conventional medicine, naturopathic, integrated functional medicine training. And then I practiced in Connecticut for 2 years with my wife. And then we practiced in California for 5 years, back to the Pacific Northwest, where we sold the California practice and then went to a 100% telehealth model in 2019 before COVID.
Ooh,
so when COVID happened, right, I was just, in pole position and was already doing telehealth. So about 70% of my practice is the United States, and 30% is all international. So I get patients from all over the world. So it's interesting to see these systems.
Great place. I think as you and I were chatting, I did my training at University of Washington, so I know the Seattle hospitals well, although I was there a long time ago in the 1980s. Now, before we get into all these clinical aspects, can you just tell us about the problem of attention deficit hyperactivity disorder? How is it defined? How is it detected? And how big of a problem is it in America?
All right, that's a really good question. So, the DSM-4 had ADD, right, attention deficit disorder. For those are people who were not hyperactive, they just couldn't really focus or pay attention. Then when the DSM-5 came out, they just merged everything under one umbrella, which is attention deficit hyperactivity disorder. And then you have predominantly inattentive type, you have predominantly, hyperactive type, or what really most, at least in children, end up with the mixed type. And it's certainly highly prevalent, but there's still a big stigma around the ability to focus and pay attention. And particularly in children, well, my child isn't like the other children. They can't sit still. And some of the more progressive schools help adapt, versus back in my day as a child in the early 80s, right? It's like everybody was just on methylphenidate. That's what you did, or you were kicked out of school, essentially. Now, schools tend to be more progressive, more tolerant, realize there's all these other interventions, and even following the American Academy of Pediatrics guidelines that are medication, right? Behavior modifications, learning modifications, testing modifications. But in our fast pace, and this very well as a medical doctor, right? When you have 5, 7, 10 minutes with the patient, it's much easier just to write out the prescription pad and then here, because this will work. And hopefully the side effects are low and your child will be fine. But as soon as you stop those medications, all the symptoms come back. And then in adulthood, right? They have a lot more problems, and you build tolerance to the medications, and then the medications aren't without their problems. But most people, in adulthood, they're not really even properly diagnosed or assessed. They just
Right. So before we get into the clinical practice, which is what we do every day, let's describe the problem. So how is it defined? You're talking about the Diagnostic and Statistical Manual. How does a doctor define it, and how common is this in the country?
Right. It's extremely common. I mean, the exact epidemiology varies, from 10% to 14%. And these surveys, sometimes they'll just survey the parents and what the parents think the child has. And, there's obviously adult ADHD, but we'll focus on adolescents since that's what most people are familiar with. And that's when you can make the most change, right? While the brain is still neuroplastic. And they're usually about anywhere between 10 and 15%. And then if you look at CDC data, they're saying in the United States anyway, anywhere between 6 and 8%. But it's certainly a growing problem. And even international statistics show our ability to pay attention and focus is going down, even just a few years ago.
Well, so ask my question. Is it truly organically growing, or is it just increased recognition of a problem that's been there the whole time?
I would say it's both, but I think it's more also our environment, right? I mean, look at social media, the cacophony, the constant bombardment with information, and the scrolling on the social media. People just don't sit and read a book like they used to, right? I mean, the attention went down from, like, on average from 10 seconds to 8 seconds just in the last 5 years.
Oh,
And
wow.
business makes a lot of money. I look at Meta, right, who owns Instagram and Facebook. They have very good metrics on how long someone stays on, say, a social media post, and how quickly they're going to flip up, and how many milliseconds to seconds you have in order to be able to capture that person on their story, right? The lead, the tag, right? To lure them in to stay longer. And you see this a lot with kids, right? The screen time. And the studies are pretty consistently bearing that out, that we live in a culture that is now fostering this inability to pay attention. And then even in adulthood, like the workplace, right? The multitasker is glorified. When you look at neuroscientists, right, they're saying that the human is not designed to be a true multitasker. There really is no such thing.
So do you think social media is actually truly contributing to pathologic ADHD?
I think that's part of it. Most kids aren't on social media. I think it's just like YouTube kid. I have 4 children of my own, right? And I know, and they have these, guidelines for screen time, but just the ability of what that does to the reward centers of our brain. Like, when you and I were kids, it's like you sat there and you had your clicker and you didn't even have cable. You had to maybe get up and turn the dial to change the channels. And now it's instant gratification. You can sit there on YouTube Kids or any of these platforms and just scroll and find exactly what you want. That's, I think, hardwiring the brain to be impatient and a lack of focus, because it's like, why do I need this? I mean, all these YouTube shorts and these other things, they're meant to be very short duration because people just cannot pay attention anymore.
Do you think there are sociocultural determinants outside of social media that have played a role? I mean, two come to mind. I don't remember any kids when I was in school in the 1960s that had ADHD. I really don't. But we had 2 things back then, and things have changed. Times have changed. But we had corporal punishment.
Yeah.
I mean, if a kid was acting up and all over the place and went to the principal's office, that kid was paddled. I mean, with a wooden paddle, and it hurt. And that kept a lot of people just, still and not squirming around, I think. And then the other thing that we had back then is we had a ton of physical activity. We actually had mandatory physical education. Kids were playing outside, and I just remember endless hours of physical exertion. Do you think any of these really have a role? If we have to take a child and bolt them into a desk for 6 or 8 hours a day.
Right. Yeah, those are good points you bring up. I mean, the days of punishment versus discipline, that's different, right? Discipline, children need discipline, right? Everybody does. You need to be able to have a routine and focus and strategy. Otherwise, I mean, they're a child. The child is supposed to be wild and imaginative, but there's a
Mhm.
time and place to be calm. There's a time and place to be
Mhm.
quiet. There's a time and place to be creative. And more progressive schools can instill that. Just tying the kid to the chair really isn't going to work,
Right.
even if it's euphorically. Um, but yeah, you're right, is that, even when I was a kid, you went outside and you played.
Mhm.
You played with your friends, you played in the street, you played games, you're always playing activities. And in school, lots and lots of, recesses and, PE and things to run
Yeah.
off that excessive energy. And then, of course, you kind of have a few minutes to come back in and you calm down. But humans, as you know, we are not designed to sit and just be talked to for hours and hours and hours at a time. And
Right.
that's the way the US school system is built, right? It's very efficient to disseminate information, not efficient to learn. So I think
Mhm.
schools, at least my kids, we live in Gig Harbor, Washington, and they do seem, even the public school systems are very progressive, almost Montessori like, hands on
Mm.
learning, skills learning, group learning. Where things aren't just a teacher standing up in front of the room pontificating, but you're right, is that, my kids are just as susceptible. They'll go outside and play with the kids in the neighborhood, and the kids will be like, I'm bored. I don't know what to do. What do you mean you don't
Mhm.
know what to do? You're a
Yeah.
child. Go play. It's like, what, guess you don't have your tablet, you don't know how to play.
But there's an old saw. It's hard to not fall into it, but and some cultures have a word for it. But do you know every successive generation thinks the way they did it when they
Okay.
were kids, it is better or more disciplined or more virtuous than the subsequent generation.
Yeah.
So, there were parents back in, the mid 19th century, let's say 1850, that said, the kids now in 1870 are lazy. They don't respect their parents. They don't pay attention, what have you. And nothing changed. It was still pen and paper and largely
Mhm.
an agrarian society. But it's true, every successive generation. So I look back and I say, wow, we didn't have all these problems and corporal punishment. Could the reality be is that every generation faces all these new challenges,
Yeah.
faces all these new pressures, and that the human mind and body is just adapting to this?
Yeah.
I mean,
Yeah. I agree with you in that a lot, is that, each generation has their own things. Like I have three older brothers, and I talk to my mom, and she just says, I'm just thankful that I didn't have to raise you guys in the days of today of the tablets and the social media and the internet, because you guys could use your creativity more. But, these kids nowadays, right, they're literally like born with a phone in their hands,
yeah.
right? They know how to use that. My 2-year-old can, when he gets his tablet time, he has his YouTube Kids and his Kadopi and these learning apps. He can navigate those, and of course he can't read faster than I can navigate them,
Yeah.
and I'm
And
not
how old
technological.
and how old is he?
He's 2. My
He's
youngest
two
is 2
years
years
old.
old. Yeah.
Yeah.
So he has these games on there, and he builds things, but he also we also like, okay, it's enough screen time. Now let's take that to real world, and he'll play with his other siblings with
Mm.
magnetiles and Lego
But
blocks,
but
but
yeah, I have
constant
to
adaptation.
yeah, I have to say that I just the world changes and the generations that we're in are managing a velocity of change. You think from the 18th century, 19th century, early 20th century, it's paper and pencil. That's
Yeah,
it.
right.
That's all you have. And then this velocity of change, electrification around 1910, 1920. And, when I was a kid, there were no phones in the house. You could
Yeah,
go to a phone booth and call. And then I remember the very first early phones in the house. There were party lines we had to share with other neighbors down the street. And I certainly remember, going through the entirety of my education without computers. So
yep,
it was paper and pencil, and then glass slides on the board or chalkboard, what have you. And then, sure enough, all this happens, and so now
yeah,
we're on computers and cell phones, and And so it's impossible to look back, but I think the velocity of change now is so substantial that
Mhm.
no one could have envisioned a 2-year-old could navigate YouTube.
Yeah. It's so hyperbolic, it goes at this crazy pace. And in my own kid's school, so they have, there's Washington State standardized tests, and there's the national standardized test. And start to be assessed in first grade. And everything that they learn for the most part, is still old school pen and paper. I mean, yeah, they have these TV screens that the teacher can
Mm-hmm.
touch, and they do a lot of electronic learning, and they try to balance. But when they take their standardized tests, it's all on the computer. So the teachers, when you meet with them for their conference, they warn you that they're like, look, the scores on this are going to be lower than what it is in class, because they're just trying to learn how to use a computer and find out what to click, where to click, and some of them
Yeah.
don't read that well. And so
Mm-hmm.
they don't do any of these tests on like Scantron, Bubbles, or pen and paper. So it's like they learn one way on paper, and then everything else is all on the computer. And then when they get to high school, all their homework is turned in on computers.
It's all
I was like, well, how do you
computer.
do your math?
Well,
Like,
let me just ask you a few basic questions about this condition or this diagnosis,
yeah.
ADHD. Is it a clinical diagnosis? Is it just something a doctor says a patient has, or is it subject to some type of, psychometric instrument to make the diagnosis?
Right, that's a good question. So it is a diagnosis of clinical observation, and the DSM, the way it works is that you have specific criteria. It has to be going on for 6 months or longer. The
Okay.
symptoms have to be present in 2 or more scenarios. So if they just have symptoms at home and not at school, or vice versa, they don't technically qualify for it. So there is a criteria
Hmm.
that they meet. So if, like, say they are just an animal at school, but they're well behaved at home, they don't technically qualify. But
Hmm.
it's the pediatrician or the family practice is just mostly going to go on what the parents are relaying, and also sometimes what the kid's doing in the office, right? If they're trashing your office and they're,
Mm-hmm.
you can tell that they're obviously very hyper and they're impulsive and etc., then it's a given. There are some more advanced testing. There's actually this questionnaire that you have to pay for it to download, but then you can use it in your practice forever. That has been showed. It's just a questionnaire for the parents, and
Mm-hmm.
then also the teacher, and then the child can, depending on the age, can answer some questions, and then it
Mm-hmm.
rates on a score and gives you a
Mm-hmm.
higher probability. But again, in clinical reality, the parent comes in, they have this and that going on, they're talking with their child, they're just going to get the diagnosis. They're really not doing these in the clinical world.
And when you do a video call with the parents and or the child or both, can you ascertain that over basically a video call?
Yeah, usually it depends on the child, but I'm mostly going by what the parents are telling me, and also, clinical practice, right? You kind of
Okay.
know,
Mm-hmm.
you know, most of the time they're not going to be malingering, right? They're like, my child is this, that. And usually the people that are getting brought to me, they either failed medications, don't tolerate them, or they don't want to go on them, or
Well,
they're
yeah.
adults and they're just over medicated. And they're like, I can't
Oh,
even sleep because I'm on so much,
okay. So the patients you're seeing essentially have an established diagnosis.
Usually they have an established diagnosis. About 10% of the time, the parent will say, look, I think my child has got ADHD, or they're like, I'm not a doctor or something. But now that the world of, it used to be Dr. Google, now it's like Dr. ChatGPT, Dr.
Yeah.
Grok, Dr. AI.
Yeah.
They'll be like, oh, I plugged this into the, ChatGPT, and I think they come in with all these presumed diagnoses, and then we have that conversation about AI
Well,
hallucinations and things like
well,
that.
well how good if a parent, types in a paragraph of kind of vignette of their child, and then they hit these high points in terms of chronicity, and then it
Yeah.
occurs at school, at home, and what have you. How good is AI in saying, yeah, it's ADHD?
I would say maybe 50%,
Really?
right? Because
Okay.
it'll give you a lot of other, AI is only as good as the language that you put in there, right? That's how it
Mm-hmm.
works. And so you can kind of feed it whatever you want, and then it prompts you for all these other things. And I would say in that world that it can do a pretty good job. I get lots of patients that come in with all sorts of conditions, and I won't read the whole AI script because they're too long. But most of the time, it's totally incorrect, right?
Okay.
It's not,
And
it's not
then
accurate.
Of those with established diagnosis of ADHD, what are the common comorbidities or the other conditions that exist in that patient with ADHD?
Right. That's another good question, which I talk about when I give this ADHD presentation at conferences. I think a lot of these comorbidities are totally ignored or they're not
Okay.
really assessed because they're very common. You're talking up to like 60, 70% of individuals who have ADHD have these other comorbidities,
Okay.
anxiety, and it's a little bit different in adults. It tends to be more depression,
Mm-hmm.
anxiety, and substance abuse, which makes sense to me because they're self-medicating, right?
Mm-hmm.
You're trying to calm down at the end of the day, trying to go to sleep. So what do you usually do? You maybe consume some alcohol or something. In children, I think the anxiety piece is missed a lot. And that also maybe because, in children, it's hard for them to explain. They don't know what anxiety is, but, and I'm not a mental health care professional. I just see a lot of mood disorders and ADHD, but I think, um, what's more outstanding, which is the obvious when I get kids who have not only ADHD, but the parents are bringing it to me, they don't really even care so much about that. But the kid who is extremely defiant, aggressive, violent, violent to other people, violent to themselves. And that's where they're really quite concerned because they're like, we all walk around eggshells around our child. Yeah, they're really hyper and we love our child, but the hitting, the biting, I've had children get brought to me, adolescents, teenagers, where they like strike the mom. I'm talking like, cold cock them in the face, hit them in the stomach,
Oh my Lord.
violent, a lot of violence. And then there's always these overlaps. But I think that things like conduct disorder and oppositional defiant disorder, right? These are
Mm-hmm.
children who have complete disregard for authority. They don't see them as authority. It's not the normal control. So discipline doesn't really work like it normally would.
Right, right. So, how about other conditions? And come thinking about it, how about autism and seizures and tics?
Yeah. For me, the way I see it is that the autism spectrum is, this wide, right? Where you have ADHD, mild symptoms, all the way through Asperger's and full blown ADHD. And I know there may be some listeners that, particularly, neuropsychiatrists that may, and adolescent psychiatrists that may disagree. The reason I see in them is because there's so many symptoms that overlap with one another, just
Mm-hmm.
with varying degrees. So I do think that they're very similar, and ASD is a larger spectrum than we give it credit for. And I also treat them a lot the same, and I get the same results.
Okay, okay, fair enough. I mean, what I know when people have tried to classify them, that among those with ADHD, maybe 10% have autism spectrum disorder, and of those with autism spectrum disorder, it's about a third have ADHD. So it's not kind of an equal Venn diagram when those have tried to separate it, but I'll accept that
Right.
it's certainly a continuum. How about other things like obesity, diabetes, allergic disorders?
So they may not, like when a child is young and very, say virulent, these things may not manifest yet. But, if you look at the data for diet and,
Hmm.
autism spectrum and ADHD, right, is that unlike adults, children can't control their emotions real well. They can't control their physiology really well. But as an adult, think about what happens if you haven't eaten in a while, right? I mean, there's some people that can, yeah, they can go fasting forever, they're fine. But for the most part, brain fog, fatigue, headaches, inability to focus, pay attention. It's the same thing with the child, but amplified, right? I mean, these are metabolically overdriven little creatures, right? So it's important to keep them eating healthy regularly, but and given the American style, right? Everybody's in a rush or in the morning,
Hmm.
you feed them some garbage cereal that's got all this artificial high sugar. So, their blood sugar goes like this and they have that equal crash on the other side. So when hour into school, they're all faded out and they're irritable and they can't focus. And the teacher's more just like, all right, your kid is, ADHD, or,
Mm.
you're not listening, not focusing. So, and then, yes, of course, the problem with obesity in the United States is just, so rampant.
Mm.
Childhood obesity, look at these numbers. And then you're getting more blood sugar problems, more insulin problems. We're not eating uh, a nice, healthy, well-balanced,
Hmm.
diet anymore.
Hmm.
That's why it's called the standard American diet, the SAD diet.
So, is it true that if a child has an established diagnosis of ADHD, and you give them a big bowl of M&Ms or Starburst, that it actually does worsen the behaviors? Is that true?
That's very true. And
Okay.
I've argued and debated pediatricians and family practice docs many, many times, not in a heated way, more of an intellectual, academic way, where they say diet has nothing to do with your child's ADHD. They are starting to accept that, yes, grains,
Hmm.
whole food diet, these things, but generally the general public and the conventional medical model does not believe that simple carbohydrates, artificial flavors, sugars, sweeteners, colors cause issues, but the evidence refutes that. We're not talking just observational evidence. These were many trials that were double blind, randomized, placebo controlled, where
Hmm.
they would give multiple, and it's not even just different, it's also different authors, where they'll give say children with a diagnosis, a DSM-4 or 5 criteria,
Right.
and they'll give them one of these studies. For example, they gave them an artificially colored and flavored drink,
Yeah.
and then the control group drank something that tasted similar, looked similar, but didn't have anything artificial. And then they watched them, and they basically did a bunch of subjective and objective parameters, and they showed that, yeah, these kids were bouncing off the walls, they were more aggressive. And there's been studies over and over and over have shown this. So like with my patients, that's the first thing that we do on the treatment
Hmm.
plan is, no artificial colors, sweeteners, flavors, dyes. And the parents, I usually get pushback. They're like, "Oh, well, my kid's such a picky eater and they just love
Hmm.
their Fruit Loops." I'm like, "Look, I'm not saying we're taking everything away from them. There's so many options now.
Hmm.
You can get another brand of these Fruit Loops that doesn't have any of the artificial in there,
Hmm.
and you will notice results because the studies show it,
Right.
and I've seen it clinically and over and over and over. So there's a lot of evidence for these, simple sugars, artificial anything that worsen symptoms, even in individuals that don't have ADHD. There's studies where they give
Oh,
people
good
like you and
point.
me
Yeah. Hmm.
these artificially flavored ingredients and sweeteners, et cetera, and the dyes. And then they have people do tests before and after so take a math test and then drink this thing and then take another
Hmm.
test and see what happens. So, when people say, "Oh, no, there's no evidence," and I was like, "Oh, yeah, there's plenty of evidence. You
Yeah.
just
So
not to."
so that part's pretty solid. Um, we've been talking to Dr. Todd Bourne, who's a naturopathic physician and who is an expert in attention deficit hyperactivity disorder. We're going to take just a break for our sponsors, and we're going to be back on the backside. And I really want him to fully develop his clinical approach and how he's helping people get better, because you're going to be amazed at what you're going to learn. You're listening to the McCullough Report. Let's get real. Let's get loud on America Out Loud Talk Radio. This is McCullough Report and Focal Points Substack. Pause right here. Let's get real. Let's get loud on America Out Loud Talk News. This is the McCullough Report and Focal Points Substack. We're on the backside with an expert, a naturopathic expert on attention deficit hyperactivity disorder, Dr. Bourne. Dr. Bourne, what percent of all of these kids you see with ADHD, what percent of them have basically get put on prescription drugs?
Well, it depends. All of them eventually will. So
Oh,
I get
really?
one camp
Wow.
where they um, the parent will think, they're like, "My kid definitely has some symptoms. This is what I want to avoid." I'll get another camp that says, "My kid has already been diagnosed. The
Mm-hmm.
pediatrician, the school is starting to pressure me for medications." And then the other camp is people, and usually these are like preteens or teens
Mm-hmm.
who sadly are basically just zombies, right? They're just so medicated to keep them still and focus.
Oh, my
But
Lord.
they're having a lot of side effects from the medications, right? You're having the
Mm-hmm.
growth problems, the anorexia, these things, because it suppresses appetite. That's why it's a drug these drugs are commonly abused.
Mm-hmm.
And they're like, I don't, even the child themselves, when I talk to them, they hate the way they feel.
Oh my
They're
Lord.
just like, I'm just basically, going through there. I can't sleep. I'm not hungry. I'm, losing weight. And now I'm falling off the growth charts, right? Because I don't really eat that much. And then I've got, my heart's racing, etc. So pretty much everybody ultimately will end up being on these medications
Oh my gosh.
unless see
This
someone
sounds,
like me.
yeah, unless they get what we're about to hear. But what you're saying is the natural history, without some type of break in the approach, is essentially a freight train of drugs,
Yeah,
right?
yeah, pretty much. Yeah.
And they're largely stimulants, right?
Yeah, I mean, the first line, of medications are, the amphetamine type drugs, the methylphenidates. So there's the short acting medications, the stimulants, then there's the long acting, and then there's mixed. So most of the time when I see teens, they usually are taking a long acting medication in the morning that then wears off
Mm-hmm.
around right after lunch. So to get
Mm-hmm.
through the second half of their school day and then also to be able to do their homework or what have you, they're usually taking a short acting medication. So now they're just on stimulants most of the time that they're awake. And then usually they're having issues like I can't sleep, or it's making me anxious or making my
Mm-hmm.
heart race. I'm not really hungry. And even the parents themselves are like, I just don't like my boy anymore, right? I mean, it's not the same kid. They're a zombie.
What do you think the general rate of having at least one side effect on these drugs is?
Oh, they're very high. Most people have a side effect.
So,
That
yeah.
side effect is
So,
usually loss of appetite, right? That's an
mhm,
appetite suppressant. Even in before the GLP-1 receptor agonist
right.
came around, most weight loss clinics, that's what, because the FDA does have some of
Mhm,
these medications, the stimulants approved. They don't increase your metabolic rate. They just don't make you not hungry.
mhm,
So I would say most people are definitely having at least one of these side effects. And that's why some of these other drugs are used now, like the SNRIs and some of these other
right.
ones that are
Right.
lower down on the intervention list because they're not as effective.
Well, let me ask you another question. Of the studies that have actually done polysomnography or a formal sleep study, what percent of people taking these drugs have a disruption in, the healthy sleep pattern of REM and non-REM sleep?
Right. I haven't looked at too much of those studies, but there's certainly subjectively people tell me that their sleep architecture is messed up. They're like, I can't
Yeah.
sleep,
Can't.
especially as you get into adulthood, right? They're like, now I've got stuff to help me focus all day, but I can't sleep. So then I got to take my sleeping pill. And this is making me anxious, right? Because it's pharmaceutical speed. I mean, that's what amphetamines
Right.
are.
Right.
And
That's
so,
my experience. I'm a allopathic doctor, so I see these patients too. That's my experience. Is that I think they almost all have some even if they can get sleep and they go to sleep. My
right,
impression is it's not high quality sleep, because if you ask them, do you feel well rested the next day? Do you feel
right,
they don't, and it's a vicious cycle. So not feeling well rested creates uneasiness, and then there's this. It tends to, I think, kind of easily morph into free floating anxiety with this uneasiness, and it becomes a vicious cycle. So, Dr. Bourne, how do you unwind all this in your clinical practice? You started to tell us about some fundamentals on diet, but go ahead and take it from here. Just kind of give us your comprehensive approach.
right. Yeah. And piggybacking what you said, that's a negative feed forward cycle, right? Is that they can't sleep, they don't sleep well, which directly inhibits their ability to focus, pay attention, and
Oh,
memory.
yeah, good point.
Even if you don't have ADHD, that memory and sleep are directly tied in, which a lot of people, may forget. But for me, it's, as a naturopathic physician, our training is we have this thing called the therapeutic order where you're utilizing, generally speaking, the least invasive, least aggressive interventions first. Saving drugs and surgery is a last resort, but you have to meet the person where they are, right? If someone cuts off their arm, it's not a time for botanical
Hmm.
medicine, right? They need emergency care. So for me, they come in, they just lay it all on me, and then I usually also look at family. So I always like say, okay, because ADHD is extremely genetically linked, and the genes have been pretty well identified. There's about 10 or 12 genes, and I'll always say they've even done studies in homozygous twins,
Hmm.
where it's like a 96% concordance rate that both twins will have ADHD. So it's
Oh,
highly
really?
genetic. So I'll usually say, who in the family has it? Who's got it? And usually the mom's like, oh, dad. He can't sit still. He can't focus. And the reason I like to know is one, to help them normalize it and get rid of the stigma, but also then it's kind of a family affair, right? Let's all work together, versus just the kids eating a special diet or something. Everybody's kind of have to get involved here. So for me, it's, what are the symptoms? What makes better and worse? Have you noticed any triggers? Have you done, even the American Academy of Pediatrics, right? Their recommendations are no medications before the age of 6, unless mandatory, unless you have no other recourse. And if you look at these studies, it's something like 30% of children 4 and under with an ADHD diagnosis are on medication,
Oh, my
when
Lord.
that's not even the guidelines. And I'm sure some of that percentage is because, maybe they're very
Hmm.
violent and they've got to get something right and people want to address it. But again, it's just they're band-aids, not anti-medication, but there's a time and place. And in my experience with hundreds and hundreds of patients, thousands of times of ADHD in children and all the way through adulthood, I've never had to use a medication, and they've all been able to either get off their medications, or if
Hmm.
they're an adult, and they're
Hmm.
not as neuroplastic, maybe they're down to just 5 milligrams of their Adderall or something like that
Okay.
versus 20 or 40, and they're having all these
Hmm.
side effects. So a lot of it is, I also talk to them about diet. So really it's the first thing I end up doing with them is I talk to them about diet and the studies. And then we
Hmm.
also assess, where am I going to go? Is this a person who they're just super fun and just really high energy, right? Well, let's get them to do some things that are more active, but still do their things. Or is this now a violent child or an adult where now we have to bring on some, different interventions and strategies? So I use a lot of homeopathy. There's also quite a bit of data for nutrients. And
Hmm.
again, pediatricians don't, because it's not their training, right? Same with family practice. So a lot of evidence with children who are aggressive and the inability to focus
Hmm.
have low iron. And if you talk to parents, usually it's because they're also tend to be picky eaters. They're not eating a whole lot of iron-rich
Mm.
foods. Zinc, and most people know zinc for the immune system, but zinc is a cofactor for neurotransmitters, vitamin C and zinc. So a lot of times, particularly serotonin and dopamine, right, are mood neurotransmitters. So you kind of see what's going on. I look at nutrients, look at diet, lifestyle. I usually will talk to them about bringing, I'm a big fan of behavioralists, because the behavioralist helps the child, gives them strategies to adapt to their environment versus just, losing it when their fuse is this big and smashing the place.
Hmm.
I think those are underutilized. Same with occupational therapists. It's just, again, it's quick to get the script pad out. So we talk, and I don't want to make it overwhelming to them. So the first visit is getting all the information, discussing things, triggers, what makes better, what makes worse, who's got it. Okay. If you notice, particularly foods, we're not just the sugary foods or the artificial, but what about, food sensitivities, which is different than a food intolerance or
Hmm.
a food allergy. And I'm like, if you notice anything, if they, the common suspects would be dairy and gluten. And there's some good evidence with how they're degraded in the body and binding to opiate receptors, and different than you or me who can digest them just fine. So we talk all about these, and then I end up going through homeopathy, constitutional homeopathic medicine, and like I said, doing this a million times, can't tell you how many times the teacher has gone back to the parent and said, "Oh, when did they start medication?" And the parents, because they usually don't want to deal, they'll just be like, they just don't say, "Oh, I saw a naturopathic physician that did homeopathy and gave my son a multi and did some diet changes." They just, they'd rather just say whatever, because the teacher now sees an improvement. So it's this therapeutic order of diet, lifestyle, behavior, and then bringing on the supplements as needed to get intercalated into cells, and then kind of these higher loading doses to saturate the tissues, replenish the stores, and then you can taper down. And most children, literally by diet, a multi, a fish oil, and the diet and the homeopathic, they have zero symptoms.
Mm. Now, what's the difference between a homeopathic and a supplement?
So homeopathic medicine is actually regulated by the FDA. Homeopathy has been around for over 250 years, and it doesn't fall under the classification of a dietary supplement. And what's interesting to me, I'm not a homeopath. I'm just a naturopath who uses a lot of homeopathy with my
Hmm.
patients. And it's the most popular medical modality in the world, but it's also the most contentious medical modality in the world.
Hmm.
And there are reasons for that, which we won't get into, but there's about 5,000 different homeopathics. In reality, about 100 of those are pretty common. And then there's another 30 or 40 that are called polycrest that are extremely common. That's what most children and adults end up being, except for the more pathological cases. These are the violent kids, the aggressive individuals. They need a more pathological, deeper state remedy to kind of get rid of all those things. So
Hmm.
dietary supplements would be things like vitamins, minerals, botanicals, amino acids, protein. And homeopathy is just a different medicine that's not technically classified as a dietary supplement.
Okay. Well, at the lecture that I attended, you went through some common, I believe homeopathic products or supplements or both. Can you kind of go through some of them? Just give our audience a sense of your range and depth and how you use these.
Sure. When anybody sees me for anything, I see a lot of everything, but I tend to go into you'll get, especially the very complicated, refractory, difficult to treat people, I'll say, just to keep them, motivated and give them some faith here that, I'm their last stop. Usually I'll say, you get tired of seeing me before I run out of options. And that makes them feel good. And it's true. I mean, I can go a long time before my armamentarium gets used up. That being
Hmm.
said, if I haven't made a difference in someone and within like 6 months, I'm obviously missing something. I'm not going to just
Okay.
have you keep
Yeah.
seeing me. I'll send out. But so homeopathy, for example, there's different kinds. One is called acute homeopathy. And those are you can go to the health food store and even many pharmacies, and there's those blue tubes from a company called Boiron, and you bang your arm and you get arnica, right?
Hmm.
Or you get a bee sting and you can get some ledum. That's different than constitutional homeopathy, is where you take a person's mental, physical, and emotional self and
Hmm.
then match those symptoms to a particular remedy. And then there's what I call shotgun homeopathy. And a couple of doctors at at ISOM came up to me and said that they've tried some of these medicines without much success. And these are, you'll go on the shelf and lots of brands carry them, and there might be like 13 different homeopathic medicines in one tablet.
Hmm.
And it only works if that individual with those symptoms, talk about personalized, medicine, needs one of those homeopathics that's actually in that mix. So that's why they don't usually work. And they have stuff for allergies. They're all over. And I don't really use a whole lot of those because I don't find them to be terribly effective versus the constitutional, which is you match one of those and you give it to them at a higher strength than what you can buy over the counter because it is regulated by the FDA. So technically, you're not supposed to be able to buy anything over a 30C, which is the strength, like a 200C or a 1M online. But the way e-commerce works now, it's like you can practically find anything online, even though you're not supposed to. You can, but yeah, the homeopathic medicines, and I'll get parents that are like, oh, they're trying to help their child, and they'll come in with bags of supplements and all these homeopathics, and they're like, I haven't really noticed anything with any of these. And with any patient, I'll explain why to them. I'm like, well, the reason this doesn't work is this, and this is not a good quality brand. And but usually it has to do with quality, but also dose. It's
Hmm.
underdosed, right? It's not enough to actually make a therapeutic benefit. Where someone's like, oh, I'm taking 500 milligrams of this omega-3. It's like, well, that's why it's not working. You need like 2,000 milligrams, and
Hmm.
then we can start making it, lowering the dose as you go by.
Okay. Well, do you have a few though on the supplement side that you think are bedrock
Yeah.
that in addition to the
So,
multi?
yeah. So I've always end up giving I'm a big fan of multivitamins, and you know, one camp will say, oh, you're wasting your money, right? It's just you're peeing it down the drain and you know, get everything through food. There's a problem with that, right? Is that Americans don't typically eat very well. That's why it's a supplement, right? It's supplementing the gaps that are missing in the diet. And also, there are certain nutrients that are deplete in our soil in the United States. Magnesium is one, selenium is another.
Mm-hmm.
Or people are vegetarian,
Mm-hmm.
they don't get any iron or very little. The phytates in their foods block zinc absorption. You see where this is going. So I discuss parents, depending on the age of the child, about blood tests, right? I don't want to poke a child unless we need to. And usually they're like, oh, yeah, I definitely want to know. I mean, you don't want to give a child iron unless they need it, but it's very rare that I do not see iron, at least insufficient, even by CDC
Yeah.
guidelines in a
Mm-hmm.
child. So, you know, we go with the multi, like the base foundation for me, and there's a big correlation to the gut, like the gut brain axis, since
Mm-hmm.
about 70% of our neurotransmitters are produced in our gut. So talk to the child, like, what are their bowel movements like? They're like, oh, they don't go for like 3 or 4 days, and then it all comes out a lot, and you know, it's really loose. And so I usually give people a hypoallergenic probiotic, you know,
Okay.
that's high quality, and then the multi. And usually these are powders because they're
Mm-hmm.
kids, they can't swallow pills, and
Mm-hmm.
chewables usually they're not that palatable, right? They're chalky and they don't like them. And then an omega-3 fatty acid fish oil,
Mm-hmm.
preferably something that has something called astaxanthin. So astaxanthin is what makes krill, you know, the
Mm-hmm.
pink color, or shrimp pink. But we're
Mm-hmm.
not talking microgram doses that you see in most supplements. It's milligrams, and that's
Mm-hmm.
what makes the difference. So
Okay.
usually it's an omega-3, you know, with some astaxanthin, a multi, and then we use the herbs later because, again, palatability. If I'm not getting enough momentum, then we
Mm-hmm.
start talking about nootropic herbs and calming herbs and herbs that help with focus. You know, and I usually use glycerates for that because most of these botanicals are they're pretty bitter. But in glycerates, they're sweet. So you can put them in a little bit of juice or just a little water. Or some kids, they'll just drink it
Mm-hmm.
right off the dropper because they have glycerin in them.
Well, what are some of those botanicals?
So there are a lot, the ones that are very safe and very well tolerated, right? And these are the ones that are, there's classifications of botanicals. Ones are
Mm-hmm.
called nootropics, right? Those are the ones that help people
Mm-hmm.
think, focus, and memory and concentration. And then there's when examples of that would be like Gotu Kola, Bacopa, Ginkgo. Bacopa and Ginkgo can be kind of stimulating for some people. So
Mm.
if, you know, for those who are on the more hyperactive side, I might use some other more mid-range, like in Chinese medicine, right? You have these yin and yang. So you have yin tonifying herbs, which are much more calming and nutritive. Yang tonifying or more stimulating herbs, like certain ginsengs. So I might go in the middle, like with Gotu Kola. Then there's nervines or nervines, which
Mm-hmm.
would be things like lemon balm, you know, saffron, which has got
Mm-hmm.
great data. I think you might remember from my talk where there was a head-to-head trial of methylphenidate, which is Ritalin,
Mm-hmm.
versus 28 milligrams a day of saffron
Mm-hmm.
or placebo. And the saffron was effective at relieving ADHD symptoms with zero side effects. And saffron has the added benefit of helping you sleep. So it's like,
Oh, okay.
even the article was like, they recommended this over, you know, as a first line therapy.
So
And then there's
is saffron a common one then that you recommend?
saffron is a common one in those who are more on the conduct disorder agitation type, like
Mm-hmm.
more aggressive. I do warn the parents that you may see about 10% of the time the child or the adult will get worse, like the more aggressive. I say give
Mm-hmm.
it a month, you know, and if there's no change, because it works on the serotonergic system. If they're
Okay.
not any better, or they're you know, in a month, quit the saffron. But for the
Mm-hmm.
most part, yeah, it's you know, you can it's the most expensive spice in the world, so it's easier just to get it as a supplement than
Wow.
it is to try to buy the actual spice and mix it into
So,
something.
so how about ashwagandha?
That's another classification, is the adaptogens. So
Mm-hmm.
adaptogens are great because they do run this even larger spectrum where they're very stimulating versus the calming. So, for example, people always think of ginseng. Well, ginseng is a great example. Panax ginseng, which is Chinese or Asian ginseng, That's a very stimulating ginseng. Where American ginseng, Panax quinquefolius, is a much more calming ginseng, but still tonifying. Ashwagandha is kind of in the middle and dose dependent. So ashwagandha's got great studies, particularly on that anxiety, the more anxious type of person with ADHD, because what is an adaptogen? By definition, it helps your body adapt to any physical or emotional stressor. It helps your body adapt better. And there's lots of them, rhodiola, Eleutherococcus, licorice root. But for children, I like more of the ashwagandha, the lemon balm, the Avena sativa, which is the milky oat. Doesn't have gluten. The go-to cola, because those are much more calming with that hyperactive child. If you start to give them a whole bunch of these stimulating ginsengs and adaptogens and these nootropics, they're just going to be bouncing off the walls, and you won't see the family usually after a visit or two, because they're like, you just made them worse.
Oh my Lord. So you take a patient and they come to you on medications. You're able to get your program going and down titrate medications. On average, how many different homeopathic remedies and how many of these supplement remedies would somebody be on in your practice?
The older they are, the harder it is it's still doable. It's just a little slower because that brain has made those neuronal connections. So if I have a 30-year-old who's had this their whole life, it's still totally fixable, just takes a little longer, and they may need a little more tweaking. But with the homeopathic, as long as you nail it the first time, they will usually stay that remedy for a year or two until you kind of unravel what needs to be fixed. And then they go into a new remedy. And in the supplements, honestly, I usually don't end up using, I'm not a heavy-handed supplement provider in general, but in cases like this, usually 95+% of the time, between diet, homeopathic, the fish oil, and maybe some botanicals, maybe short-term extra zinc, because zinc came up low or something on the blood test, or some iron because iron was low. That's it. So maybe 3 to 5, and that's all they need. And they don't need high doses of them after the loading doses.
Right. And so do you point your patients to a particular place to buy these and recommend the doses?
I do, so I'm in one of my hats, right, is I'm a subject matter expert, consultant, and advisor to the dietary supplement industry. So I work with a lot of companies in various channels. That there's a reason that the dietary supplement industry gets a bad rap. I mean, is that there's a lot of just garbage out there. People think it's unregulated. It's not unregulated. It's highly regulated. It's poorly enforced. So it's the Wild Wild West. It's like a pseudo Wild Wild West. So I do not like Amazon or eBay, because they're always in trouble. Lots of fraudulent products, contaminated products, things not meeting label claim, things not even having the right ingredients in there, things that are contaminated. So I use these professional virtual dispensaries, and what they do is they buy directly from the manufacturer, and then the patients can only buy through them with my doctor account. So then I just type everything up. They go in, they order what they need to order, and then it gets shipped to their house.
Oh, wow. Okay, so that's very orderly then. It's not it's not subject to all kinds of craziness on Amazon or these commercial shopping. This sounds quite organized. Dr. Bourne, we're coming to the end. This has been such a great interview. I think you've enlightened us greatly on this opportunity. Let me just ask you one last question. In your experience, when you're seeing these individuals, how many of them, with your approach, are you satisfied with the final result, that they're better, they can sit and focus now, and whatever? Just give us a fraction of what you think is success in your view.
I would say it in anywhere below the age of 20, it's fortunately, knock on wood, right, it's been 100%. I've yet to have someone who no longer even carries the diagnosis. And when adults, because they've been more solidified, I've gotten people where they're very well controlled and they're very pleased that they're just down to 5 milligrams of their medication. Maybe it's just the short acting to get them through the second half of the day, but they can sleep. So for me, I'm very pleased if they're pleased and they're happy with it. And they're like, no, I feel good. I feel great. I'm sleeping. I don't feel anxious anymore. I don't have any palpitations. I can
Okay.
focus. My relationships are better.
So that's an adult. How about a child? Let's just take a 6-year-old child. If I
Mhm.
hand you a 6-year-old child who's already been started on these stimulant drugs and is all over the place, using your methods, and let's say the parents are compliant, the child's compliant, what's the chances that that child can come off the stimulant prescription medications and be on this naturopathic approach and essentially have a success in your practice?
So far, 100%.
That's amazing. That's
Yeah.
absolutely amazing. We're going to have to leave it here, but this has been such a great interview, and I hope everybody's eyes are opened up to this approach. I'm becoming increasingly, and I'm an allopathic doctor, I prescribe drugs. I've become increasingly worried that so many children are on prescription stimulants, and my gut tells me it cannot be good for our children, it can't be good for humanity, and that a reasonable naturopathic approach like this seems just far more reasonable, safer, and better long term. Dr. Todd Borden, thank you so much for being on the program.
Great. Thanks, Dr. McCullough. I appreciate it.
Let's get real. Let's get loud on America Out Loud Talk News. This is a McCullough Report and Focal Point Substack. Thank you so much for listening and watching. Okay.